Welcome to Our Daily Chews, your go-to podcast for all things nutrition. I'm Lynn Clayton, a registered dietitian nutritionist and your host. I help you sort fact from fiction with a research-based and common sense approach to nutrition science. Today, we're diving into the world of acid reflux and gastroesophageal reflux disease, also known as GERD. Acid reflux is that uncomfortable burning sensation many of us have experienced after a heavy meal or late night snack. But there's much more to this common condition than meets the eye, and that's what we're going to explore today. Let's begin with a brief biology lesson. Normally, when we eat, food travels down the esophagus, which is a muscular tube that connects the mouth to the stomach. At the end of the esophagus is the lower esophageal sphincter, which is a valve that opens to allow food into the stomach and then closes to keep stomach contents, including acid, from flowing back up into the esophagus. It's supposed to be a one-way valve, but sometimes this valve can relax or weaken, allowing stomach acid to escape back up into the esophagus. That's acid reflux. It's also commonly referred to as heartburn because that's what it feels like, a burning in your chest. Think of your lower esophageal sphincter as a security guard. If it doesn't do its job, acid can flow back into the esophagus. That becomes a security breach, and that's a problem. But I don't want to give the impression that stomach acid is the problem. Your stomach produces hydrochloric acid for a reason. It's necessary for breaking down food for digestion and absorption. It also provides you with a layer of protection against unwanted intruders like pathogenic bacteria. Think foodborne illnesses such as E. coli or salmonella, for example. In fact, not having enough stomach acid is a problem. It can lead to GI infections, damage to the gastrointestinal system, and nutrient deficiencies. Symptoms of low stomach acid may include gas, bloating, burping, upset stomach, nausea when taking vitamins or supplements, undigested food in the stool, anemia, hair loss, weak, brittle fingernails, fatigue, and interestingly, heartburn. Stomach acid is important to help break apart protein and is necessary for proper absorption of vitamin B12 and minerals such as calcium, iron, and magnesium. Several chronic health conditions have been associated with low levels of stomach acid. These include conditions such as food allergies, asthma, lupus, thyroid issues, psoriasis, eczema, osteoporosis, and pernicious anemia. And we tend to make less stomach acid as we age. The lining of the stomach is designed to withstand acidic conditions. In a normal, healthy stomach, having a low pH of around 1 or 2 is not a problem. It's only a problem when the acid leaves the area it is designed to stay in and irritates other tissues, in this case, the esophagus. So the question is, what causes acid reflux? Normally, the atmospheric pressure is greater in the esophagus than in the stomach. This pressure differential prevents reflux of gastric contents back into the esophagus. But sometimes things interfere with the body's ability to balance this pressure. Acid reflux can be caused by several factors. One is overeating. With larger portion sizes, we tend to overindulge, which can overwhelm our digestive system, causing impaired digestion, increased acid secretion, and delayed gastric emptying. The increased pressure on our stomach can push open the esophageal sphincter, allowing acid to escape. And our diet. The type of foods we eat can also cause reflux. Spicy foods, acidic foods like tomatoes or citrus fruits, high-fat foods like fried foods, chocolate, caffeine, and alcohol can all irritate the stomach and reduce the lower esophageal sphincter pressure, triggering reflux. And positioning. Lying down too soon after eating or wearing tight clothing around the waist can contribute to reflux. Overweight and obesity. Excess weight, especially around the midsection, can increase pressure, causing failure of the sphincter to close effectively. And smoking also lowers the esophageal pressure, increasing reflux. Pregnancy is another one because hormone changes, as well as carrying the extra weight in the abdominal area during pregnancy, create pressure, increasing reflux. There are some medical conditions, such as hiatal hernias, that can put pressure on the lower esophageal sphincter and cause or worsen reflux. and some medications can cause reflux. If you're taking medication that seems to make reflux worse, talk to your doctor about other options. Drugs like oral contraceptives, theophylline, benzodiazepines, aspirin, tricyclic antidepressants, nitrites, calcium channel blockers for high blood pressure, or NSAIDs such as Advil can all contribute to reflux. Now that we understand some causes of acid reflux, let's talk about what we can do to keep the acid in check. Sometimes making a few diet and lifestyle changes is all we need to extinguish the burn. Treating acid reflux requires a few things. One is we want to improve the lower esophageal sphincter competence. We also want to decrease the gastric acidity, and we want to improve the clearance of contents from the esophagus. So, a few things that we can do is eat smaller meals. Large meals, especially high fat meals, can overload your stomach and delay digestion, increasing the risk of reflux. Eating smaller meals throughout the day reduces the risk. Also, try to include protein at meals. Protein helps to stimulate gastrin secretion and lower esophageal sphincter pressure. And watch your diet. Avoid trigger foods and drinks such as spicy foods, citrus fruits, tomatoes, chocolate, coffee, regular or decaf, carbonated beverages, and too much caffeine or alcohol. Other items you may want to avoid include garlic, onions, black pepper, and peppermint or spearmint oil. Another thing we can do is make sure we stay upright after meals. Try to remain seated or standing for at least a couple of hours to let your body digest your food and use gravity to help keep things down. Avoid lying down or rigorous activity after meals. And also try elevating your bed. Raise the head of your bed by 6 to 8 inches to help prevent reflux at night. And wait 2 to 3 hours after eating before going to bed. And if needed, lose weight. If there's excess weight around the midline, then weight loss can help reduce symptoms of acid reflux. And also avoid tight fitting clothing. And don't smoke. Smoking weakens the lower esophageal sphincter. So if you smoke, quitting may alleviate the burn. And manage your stress. Stress can exacerbate reflux, so find healthy ways to unwind and relax. And if you have any medical conditions that may be contributing to it, such as a hiatal hernia, then get that repaired. That can greatly lessen the reflux symptoms. And if you're taking medication that worsens reflux, talk to your doctor about alternatives. Fortunately, when diet and lifestyle changes alone aren't enough to control acid reflux, there are several treatment options available. There are natural remedies, over-the-counter, and prescription medications. These supplements or medications work by either buffering the stomach acid, blocking stomach acid, improving motility of the GI tract, or protecting the mucosal lining. In severe cases of chronic reflux or GERD, your doctor may recommend combination therapy. Natural remedies. Sometimes people can find relief with natural options like ginger, licorice root, and aloe vera, which help soothe the digestive tract. But always consult with a healthcare provider before trying new supplements, as these can interact with other medications and may not be suitable for everyone. And then we have over-the-counter medications. Antacids like Tums, Rolaids, and Gaviscon can provide quick relief by neutralizing stomach acid. H2 or histamine 2 blockers like famotidine, or also known as Pepcid, reduce acid production. And proton pump inhibitors, also known as PPIs, such as omeprazole, which is known as the brand name Prilosec, and esomeprazole, known as Nexium, block acid production. Prescription medications can be used in more severe cases. This is a stronger or higher dose acid blocker, and these can be your PPIs or H2 blockers. In some cases where gastric motility is an issue, such as delayed stomach emptying or gastroparesis, prokinetic agents like Reglan may be prescribed. While these treatments can provide relief, it's essential to address the root cause of acid reflux. Don't ignore diet and lifestyle factors that may be contributing to the need for medications. So, getting treatment is important, If left untreated, chronic acid reflux can lead to gastroesophageal reflux disease or GERD, which can cause complications like esophageal damage and inflammation known as esophagitis. It can lead to ulcers, can lead to changes in the esophageal lining known as Barrett's esophagus, which is a precancerous condition. And if left untreated long enough, it can lead to esophageal cancer. If you experience acid reflux frequently, be sure to talk to your healthcare provider. They can help you find the best treatment plan for your specific needs. Sometimes people aren't aware they have acid reflux. Symptoms may vary and go unnoticed. If you suspect reflux may be an issue, but you haven't been diagnosed, answer these questions to determine if you might need treatment. Or if you are being treated for reflux, answer these questions to see how well the treatment is working. So, do you experience a burning sensation in your chest? How often? Do you notice food or acid coming back into your throat or mouth? Do you notice pain in the center of your upper stomach area? Do you experience frequent nausea? Do you wake up at night with a burning sensation in your chest or your throat? Do you feel the need to take antacids or other acid blockers, especially after meals? Some other possible symptoms of reflux include increased salivation, belching, pain, especially in the chest area, but it can radiate to the arm or the jaw, nighttime cough, persistent hoarseness, difficulty swallowing, or recurrent pneumonia. I want to give a word of caution. I wouldn't be giving you the whole picture unless I informed you of the risk associated with long-term acid blocking medications. While these are very helpful for short-term treatments of reflux or GERD, they are not meant to be taken long-term. In fact, the drug manufacturers recommend 4 to 8 weeks of treatment for mild reflux issues and up to 16 weeks for more serious conditions. Unfortunately, many people get put on these medications for months or years. While it may help control reflux, it can cause other problems with long-term use. Suppressing stomach acid can lead to nutrient deficiencies. We mentioned earlier that vitamin B12, as well as minerals such as calcium, iron, and magnesium, require acidic conditions for absorption. This lack of nutrient absorption can lead to anemia, loss of bone, and increased risk of cardiovascular disease. Lower stomach acid lessens your resistance to intestinal infections as well, things like salmonella and C. diff. And long-term acid suppression may also increase the risk of food allergies. On the other hand, food allergies or sensitivities may exacerbate reflux. Avoiding foods you react to can result in significant improvement in reflux symptoms. And I found this to be true for me personally. I was having several digestive symptoms until I discovered I was sensitive to gluten. After removing gluten from my diet for 3 or 4 weeks, my symptoms improved dramatically. Taking acid blocking medications didn't help. So, if treatment for acid reflux is not working for you, consider getting tested for food allergies or sensitivities. If getting tested for food allergies is not an option for you, some research studies have found that avoiding the 4 common food allergens that can result in improved symptoms. These foods include cow's milk, eggs, soy, and wheat. This may be most helpful for those with eosinophilic esophagitis. A 4 to 6 week elimination diet may help you discover if allergic reactions are the issue. Just remember, you don't have to completely remove these foods from your diet. You just avoid all of them for the trial period and then reintroduce them one by one to see which one or ones are the problem. It's best to get help from a registered dietitian when doing an elimination diet. In conclusion, I hope this episode has given you a better understanding of the causes, treatments, and risk associated with acid reflux. As always, if you suspect you have reflux, be sure to talk to your healthcare provider. That's it for today's episode of Our Daily Chews. Thanks for listening. If you enjoyed this episode, make sure to subscribe and leave us a review. Until next time, eat well and be healthy. This podcast is sponsored by Clayton Nutrition, a private medical nutrition therapy practice offering telehealth services for those needing nutrition therapy to prevent, treat, or manage chronic health issues, whether it's diabetes, cardiovascular concerns, food allergies, digestive issues, or weight management. We focus on good nutrition for better health. Check out my resources, blog articles, and one-to-one nutrition services at claytonnutrition.com. Clayton Nutrition is offering Better Diabetes Control, a 6-video module course covering everything you need to know about managing diabetes. Get your diabetes questions answered in this self-paced course. It includes a booklet and resources to guide you. Go to claytonnutrition.com/nutrition-courses to learn more and sign up to get started. For support on your weight loss journey, Clayton Nutrition offers an online course called A Better Way to Better Health. This 8-module video course is packed with resources to help you along your weight loss journey. Check it out at claytonnutrition.com/nutrition-courses for more information and to sign up. This podcast is for educational purposes only and is not intended to replace the advice of your healthcare professional. I recommend you seek help from a trained professional who can work with you in your specific situation.